Well, good morning, good afternoon, good evening. I'm so excited to be here because we're going to be meeting two very promising individuals from two of the countries that I am very close to. So I'm really excited to get started. All right. Lovely to meet you both. My name is Aradhana. I'm the CFO of AstraZeneca, and today I'm delighted to speak with you and spend some time with you. You might not know this, but before I got into finance, I trained and practiced as a physician in both India and Tanzania, and therefore know the importance of healthcare systems and work that people like you do, and really looking forward to your stories. I also want to share the experience that people and women like you have, so that you can become role models for so many other people. You can become leaders in the community and fight for equality and better healthcare. And it really helps all of us to learn from each other and inspire each other to action. I truly believe young people and change makers like you have the power to create a healthier and more equitable future for all of us. And I'm so proud of the fact that AstraZeneca's Young Health Program has supported you in these efforts. So let's get started. My first question is to you, Swarnima. Can you describe the focus of your work in health equity and your background? What prompted you to get into this area and the work you're doing?
My personal journey has been in public health for a very long time. I started my career more on the policy side. I've been with the UN and had a brief stint at the WHO and worked on various projects for the government of India, and which were not just on healthcare, but also adjacent to healthcare and well-being, such as prevention of sexual harassment at the workplace, etc. And I think one of the reasons that I became more and more interested in healthcare, and I consider that something that throughout my life, all the work that I do that will have a healthcare component, is because I think awareness is key. And when we talk about awareness, it's not just about having workshops in a closed space. Awareness really means that are the systems that you're building, is awareness built into those systems? Is it built into the policy? Is it built into the way infrastructure and urban and rural infrastructure is built? Is awareness built into the issue of mobility, financial access, or even clinical design? So that's how I understand awareness. That's how I talk about multi-stakeholder engagement. And this is one of the reasons which really prompted me to deep dive into women's health, because many times as a female, I'm currently the co-founder of Gytree. It's a femtech platform in India. We are venture funded, and many times, I think almost on a daily basis, some potential client or investor or somebody will ask me, but healthcare is healthcare, why women? And I think the answer lies in exactly this, that how both building awareness, building aware systems, and also building that service model depends on a lot of things. And gender is one of those pillars which are normally blindsided in the healthcare system. So visibilizing that is something that I feel passionate about. And that's what has led me where it has led me so far.
Yeah, I mean, women's health has definitely been a topic that has come more to the forefront in the last few years. I mean, even in the developed markets, even in the US, it's become more and more a focus. So turning to you, Juliana, maybe give us a little snapshot of your personal journey and what led you to where you are and your advocacy in health equity, and what really motivates you to do this work.
I am a medical doctor by training, who turned into a digital health entrepreneur. I am co-founder and executive director of Tanzania Health and Medical Education Foundation, which is a health tech nonprofit based in Tanzania. We build and provide digital healthcare services to promote equitable health access in Tanzania, especially in the rural, poor, and indigenous communities. We are best known for our flagship product, which is the first ever digital mental health care facility in the country. And we are now working in partnership with the government to implement a streamlined mental health helpline in the country. So we started in 2015. It was pretty much broad. We wanted to solve access gap here in the country. But later on, when we got to serve more people and learn more of the needs, it streamlined into mental health because that's where there was a greater gap in terms of stigma and access. So we moved forward with what we were learning from the beneficiaries, and now we are streamlining into something that is pretty much new, but also gives us a great opportunity to have strong stakeholders like the government of Tanzania in implementation of these processes. And yes, as mentioned before, the very first funding partners of us were the Young Health Program from AstraZeneca. And that was a really important yes that opened so many doors for us.
What is maybe in your entrepreneurship journey, what are some of the obstacles you faced and how have you overcome them?
I think the big obstacle for me was to balance the passion aspect versus the entrepreneur aspect, because I'm a medical doctor. I've never known anything about being an entrepreneur, something I had to learn while I move forward. And I would say most lessons for me came from the opportunities that I missed. So when I apply for a grant and don't get it and get feedback, that's when I learn that something should turn out in a certain way. But also it's very important for the first people who invested in us. For example, through the Young Health Program, I was able to do a mini MBA. They gave me skills I never had in medical school, and it helped me set a step further toward the journey on entrepreneurship. Giving us the funding put us in a spotlight that we're eligible for having funding partners of a certain caliber. And that itself gave us maybe 5 even more steps ahead of the journey. So not having that experience, like learning it from class and just learning it as going, that has been the biggest challenge, because it's just taken me more time, perhaps more than a person who knows it from class. But either way, an interesting journey, and I wouldn't really exchange it for anything else.
What about you, Swarnima? What have been your challenges in being an entrepreneur and starting Gytree?
My challenges have been similar to what Juliana said. So before Gytree, I also founded another company called Thea, which was basically a patient advocacy platform, and that was a non-profit. And this is a VC-backed, for-profit like health tech startup. So I think the switch was very hard in terms of, the economics are very different, right? I mean, what is it that you need to do, etc. I think one of the challenges that I genuinely faced, and this is a challenge facing all women's health companies out there, is really looking at product market fit. I think that's been a learning which has had a curve in itself. I'm very grateful for those learnings, of course. So I think that was one big challenge. Now, another thing that was in the beginning was, as Juliana said, like my background has been in policy, and building something takes so much from you. And I think one of the things that I really didn't know I needed, but I got that thanks to AstraZeneca and the community around it, is exactly that, like a supportive community that knows that can tell you that, okay, all the motions that you're going through are valid. It's common. It happens to everybody. Just keep the course, stay the course, keep at it. I think sometimes the most important thing that you need to know is that you need to just stay the course. I think that's the biggest help that can get you through a very tough day. So I think that is something that I really had from the community I found from AstraZeneca, and the One Young World Summit that was enabled by the AstraZeneca scholarship. And I think more recently, I think I had read a lot of reports before starting fundraising that less than 2% of VC funds globally go to female-founded companies and things like that. And I think when I was reading all those things, I kept myself a bit unfazed that I don't want to listen to all this. I'm just going to go there with what I have. But I did find those challenges, but we were lucky to have female funder, and it was Dr. Kiran Mazumdar Shaw who came on as our first angel investor, and that opened the doors for us in a big way. That's when I understood what people mean. I think this is something that's the reason why I believe so much in the community, such as the one that the AstraZeneca YHP thing is building, is that when we understand that when you're fundraising, you realize it's not that people have a bias and they're like, okay, now she's a woman, I'm not going to give her money. That's not how it works. It's just that the pipeline is so poor. The deals on the table that VCs get, there are just such a tiny percentage of it that are female founders. So where are we where are the women losing out? What are the factors that are making them not bring their deal on the table? Throughout this entire journey, I have benefited a lot from a community that is both local in context and global in itself. And then to pay it forward, I think that has been both rewarding and deeply challenging.
That's so true. Obviously, there are not that many companies that are being founded by women, and the pipeline is thin. And yes, getting that first breakthrough, learning as you go, opening doors is a whole different challenge. Nobody teaches you that in school or in textbooks or courses, right? So that's great. So coming back to healthcare, and women's healthcare, and Juliana, you talked about mental health. So what what do you think are challenges for women's healthcare and mental health? Obviously, access is a key one, and you're both bringing platforms, technology platforms that can bridge that gap for access, right? So technology can be a big enabler, but as you think of how technology is a big enabler in reducing that access gap for both women's health and mental health, what are still the hurdles in that area? So I don't know if Swarnima, you want to start, or Juliana, but go ahead, Swarnima.
Sure. So I think access gap is definitely one of the things which is a huge hurdle. But I just want to break that down a little bit. Now, let me just pick up the question of mental health, because there is, in women's health, one of the biggest factors is mental health. Whenever we are doing any kind of treatments or things like that. Now, what happens is that technology is an enabler, but the point over here is that, do you know how to access the right kind of care? And is technology, because technology is it levels a playing field for better or for worse. So a very qualified practitioner also has the same technology as a not so qualified practitioner. And then there are the cultural contexts that come into being. That, all right, going to a doctor in a clinic, in a hospital is great, but then if I'm sitting on my laptop and talking to somebody who talks about mental health, there is a lot of the noise in your head is not very positive. It does not enable you to take to access that care, right? And I think this is something that we were talking about. We recently launched something called as the Menopause Club, the Midlife and Menopause Club, as part of Gytree. And one of the things that we were discussing, that among the various fundamental hurdles that women have in accessing healthcare, one of them is also the superwoman myth. A lot, because women have fought so much for their liberation and their advancement and furtherance, somehow that has become tantamount to not complaining when you are struggling with your health and aches and pains. Whereas it should actually be the opposite. Your empowerment should empower you further to raise your voice and to demand better. But somehow, the cultural pressures are still there for women to just power through. So there are these, I think, cultural roadblocks that play a role. And in some cases, not in all, I think quality care in countries like India, which is privatized, it's expensive, and unfortunately, there are just not that many women earning that much. If I were to, look at the data, like the discretionary income, or the dispensable income, that is where unfortunately healthcare comes into being. It's not like buying some makeup that is considered very necessary. So healthcare expenditure is always a bit discretionary and dispensable. It just does not become a priority. So it's not really about affordability so much, but it's really about how women internalize how they should spend their money. So these are some, I think, systemic roadblocks that come into the picture, and that impacts mental health access more than anything else.
What do you think, are still the roadblocks in spite of all the efforts for access and technology being an enabler?
I like that Swarna went before me and mentioned so many things that I could totally relate to. But when it comes to Tanzania, I think there are two main points that I could highlight as setbacks that make women more into the underserved groups. There's the point of gender equity in the multi-phase of it, in education, in economic empowerment, and so forth. And then there's the whole aspect of gender-based violence, mostly affecting women and making them more vulnerable to become likely to have mental health struggles in comparison to the other counterparts. So those are the two aspects that we mainly put on the front line, and we create our solutions. But the very biggest thing that has to be addressed, and Swarnima has mentioned it, is the awareness part. So that's when the advocacy and sharing our stories come in. For example, before I start speaking anything in a community event, I share my stories. I personally have multiple struggles when it comes to mental health, and usually I just like to set it forward. I'm a young woman in a leadership position. I'm not perfect. I've had mental struggles a couple of times, and I got the help that I need, and so forth. So either you are a victim of gender-based violence or are subjected to multi-faces challenges of gender inequities, still you can stand up in your place and get the help you need and come out strong and proceed with the journey. So those are things that we try to put like in a co-position based on the context of Tanzania so as to promote women's mental health.
I mean, it does seem, I mean, in spite of all the progress, obviously, women have made, and you two are, great role models for that, being entrepreneurs, driving healthcare. The financial independence piece, as you mentioned, Swarnima, there's not enough disposable income, but it looks like women becoming financially independent is so core to reducing that gender-based violence or the cultural issues and having the access to care. So that's one thing clearly that we still need to continue to make a push on. So coming back to your journeys, maybe we'll start with you, Juliana. You did mention how AstraZeneca's Young Health Program was a key enabler, providing that community and resources, but maybe give a snapshot of how the AstraZeneca Young Health Program has actually helped you. Maybe a few more details on that.
So we got funding from the Step Up Grant and the Young Health Program, and they were the first funding partners we ever had. We used that funding to test the project, which is now on a national level, AHADI, and we started with a young group of youth to test if the approach is feasible to them, to learn more what needs they have and what solutions will serve them. So the grant from AstraZeneca put us in a place where we were able to understand deeply the need and to pilot it on a further step. So without that grant, without the trust, we wouldn't have, first of all, the assurance that we are reputable and we are eligible for funding sooner as we are speaking today, because AstraZeneca gave us a chance. So it's that context that we were able to test it. And fast forward a few years right now, it's on a national level and working with the Ministry of Health and the government to put it and scale it throughout Tanzania. So that's a little bit I can give on the relevance of what it does in our work.
What about you, Swarnima?
My story with, how I benefited from AstraZeneca's YHP scholarship is a bit, it might sound a bit culturally alien to a few, but I'm still going to share this. So, my background, I mean, rather you might be familiar, I'm from UP, from very, very small towns in Uttar Pradesh. So it's for those who don't know, it's a relatively small town in India and things. And so when I declared that I'm going to, just start up on my own and I'm going to start a women's health venture, I mean, there was, just all-round opposition and gasps of, confusion and various other things. Because at the time I was also working with the UN, and my parents and family were not able to wrap their heads around as to why I would give that up and, do something very risky. But what is women's health? Why women's health? It was just a lot of consternation all around. Then the AstraZeneca opportunity came, and I said, I'm going to The Hague as part of this, conference, this summit where there are a lot of young people and this and that. And I think it was the very, very first time that my parents took my decision a bit seriously, that, okay, I mean, if this is at if there is a global or an international stage, then maybe it is consequential. And while, these things seem like tiny footnotes in your entrepreneurial journey, but I genuinely think that, these familial barriers play a huge role. They are bigger deterrents than we give credit to. So I think it was a key barrier for me that really got crossed as a result of the scholarship. And of course, other than that, the people I spoke with over there, I developed networks which continue till today. I went to I was a scholarship holder in the year 2018. So it's been 6 years. And till now, I think those networks are very much in place. The people who've given me introductions, which has then led to funding and various other things. I think the tools to run a business, the tools to talk to VCs, it has all been because the network started 6 years ago, and it's held me in good stead till now.
So, wrapping up on women's health, how else are you committed to empowering young women? If you had, one message for other young leaders who want to make a positive difference, what would that be?
I mean, there is just so much, but I think the one thing that I'm just going to say, which has benefited me and I'm trying to do myself, is just paying it forward in very concrete ways. Making those introductions, just sitting with another female founder's pitch deck when she's out fundraising, or just getting people to invite them into lectures, invite them into events, hold those events yourselves, set aside some office hours to talk to people. I think in a very concrete and measurable way, women who've navigated certain, of these steps, I think it's very important, because without that, I know I wouldn't have been, where I am. And the second thing is that, I mean, if it is possible, if at all it is possible, I think just financially empowering women in any way possible. I've just recently started very actively angel investing in female-led companies, not just healthcare, but also maybe the whole field of STEM, even if it's like AI manufacturing, which I know nothing about. But, there was this really impressive female founder and I just went with it. I mean, of course, that's not possible for everyone. But even if you just say donating your time to a girls' school or something like that, I think concrete ways of paying it forward is critical. And without that, we will not be able to get over these roadblocks.
Juliana, what would your advice be?
My work doesn't strictly serve women only, we serve youth. I can only speak as a female leader, and I'm going to give unsolicited, maybe not so much spoken about, but for me, it has been not internalizing anything negative or disadvantages associated with my gender as a woman. What I know is I go out there, I wear my suit, I pitch, I fundraise because I'm a leader. And I'm a strong leader and I can do my work effectively. Mm-hmm. I do not internalize anything in alignment to my gender. I internalize everything in alignment to my capabilities. And I think if every woman, for some moments, especially those moments when you feel like an imposter, you blind yourself and become deaf to all those negativities and just go out there because you're a leader and you can do something fully. That could be helpful, just being blind and deaf for all the negativity and disadvantages that are associated with being a woman.
That's a very positive note, Juliana. Thank you. So maybe we'll turn the tables. Are there any questions you have for me?
Yeah, I do have a question for you.
Okay.
Based on your entire journey from practicing to India and Tanzania, what changes do you think are the best that you've witnessed throughout the process and throughout this time of your work when it comes to women as leaders?
What changes have I experienced, you're saying? Or
yeah. What changes have you witnessed throughout the time in India, Tanzania, and where you are today?
I mean, the world has definitely changed a lot. When I was in India and Tanzania, it was sort of in the 1990s, and you were practicing, so but at that time there was a huge HIV epidemic, in the country, in Tanzania, and I think the world has evolved a lot, both in terms of the conditions that affect the entire population. So I think there's been a lot of advancements in technology and medicine, which have been great. I think culturally there's been a huge a huge change. You're both women entrepreneurs. I think even when I started in business or in medicine, at that point, there just weren't that many people going into business, and particularly giving up a career in medicine and going into a completely different area was very challenging. So I think that's been a huge shift over the years, and now women are doing amazing things like yourselves. I think the ability to talk about issues, mental health, menopause, things like that, which again were topics that just would not, were not for polite society and, polite company, are now things that people are able to talk about equally and openly. So I think, over the last 4 or 5 decades, there's been a huge amount of progress, but it's, we need to keep building on what's been done before us and keep pushing that forward.
So I think I have a similar question, but in the context of, women's health research, for example, what happens is that when we are working on women's health, us as a consumer facing company, for example, and, of course, there is a lot of awareness building that goes into the work. And I think if we zoom out, right, and we just look at the landscape of just women's health research, how has that evolved? What are some promising fields that you are currently seeing active? What's the potential there?
Yeah, so I think first we have to distinguish and say, okay, well, what are we calling women's health, right? If you look at diseases that impact women and that are still the number one cause of morbidity or mortality, what are they? They're cardiovascular disease, they're cancer, right? So those are not necessarily specific to women, but still are the biggest burden, for women. Stroke, again, heart disease, et cetera, right? So when you look at those areas such as heart disease, breast cancer, lung cancer, which is sort of like the number 3 cause, there's been huge progress over the decades. So many great medicines for heart disease, and now kidney disease, et cetera, where so much progress has been made. Same with breast cancer, right? The mortality in breast cancer has improved significantly over the last 2 decades. I think for all of those, probably the biggest barrier to access or technology or further improving is actually early diagnosis. So it's not even in the therapeutic space, it's actually in the diagnosis space. And, if women get diagnosed early for breast cancer or lung cancer or heart disease, there's tremendous things you can change. Then there comes the area of women-specific areas of research, where I would say the research has been relatively poor. Things like menopause or hormone replacement therapy, things like that, where even if you look at, for example, the NIH budget, the budget that goes into research for those topics is a small fraction. I think it's few percentages of versus the total NIH budget. So I think there are we have to start looking at women's health and mental health not only as issues that impact a human body, but happens to be a female body, but actual women's issues, and more research needs to be done in those areas, and it's happening. I think it's starting to happen much more, and you see some studies come out, like I said, women health focused startups and fintech, for example, and other platforms. So it's happening, but probably not at the same scale that given women are half the population. So there's still a long way to go, but with efforts that people like you are making, I think we'll get there. Oh, it was great speaking with both of you. It's really inspiring and amazing work you both are doing. So keep up the great work, and we look forward to continuing to support you, and hopefully you inspire the hundreds of other women and girls that follow in your footsteps.